Very good afternoon to you. I'm Howard Feldman. This is the Synthesis Sunday podcast. Only it's Monday. It's Monday, the 7th of December, 2020. We promised you we would not do a podcast. We would not record a podcast unless absolutely necessary. Well, it turns out that it is. Rage is all the rage. It is chaos. There is a major breakout, and we assembled the team in order to get together to discuss with you. Before we begin the discussion around COVID-19, I want to wish Dr. Anton Meyberg all of our condolences, a long life on the passing of his mother last week, Tuesday. It's just 6 days since his mom passed away, not from COVID. And we wish him and his brother, as well as his father, a long life, which is a traditional Jewish wish for somebody who is in recent mourning. Good afternoon, Anton Meyberg. So this was predictable, but a shock nevertheless when we get the numbers when we're starting to see the numbers that we're seeing following the Rage event.
Good afternoon, and thank you for those kind words. Who would have thought after a mass gathering of people with alcohol, who actually would have thought that we would have got large numbers of spread? It boggles the mind. This is a novel virus, and we haven't been warning people for the last 10 months about certain things that can happen with mass gatherings. If we look at the numbers worldwide, there's 67,474,338 cases worldwide, with 1,543,373 deaths, and 46 million cases resolved. The United States has gone up to a staggering, once again I say staggering, 15.1 million cases, of which there's 1 million new cases in 5 days, with 288,000 deaths. South Africa is sitting on 814,565 cases, with 22,206 deaths, and 4,116 new cases in the last 24 hours. Due to the consequences of the Rage event in Ballito, we have seen more than 140 cases coming from that event itself, which has been called a super spreading event. We're going to see many more from that. Locally, Hatsola, our rescue organization, medical organization, has noted they have 65 positive cases on their books, taking the numbers to over 107, whereas 2 weeks ago they had less than 20.
All right, so it is a significant event. There's a tremendous amount of anger around it, and you and I discussed yesterday the approach that we would take on this podcast, because in reality there is reason to be angry. There's reason to be angry with the organizers. There's reason to be angry with parents. There's reason to be angry perhaps with the kids, but unfortunately, my view is we have a situation. We are going to have to just deal with that in a positive way, maybe put all of that aside for now and figure out how to move forward. I believe the organizers, parents and kids perhaps have some introspection, have some introspection to do, but I don't know that us maybe lambasting or us going that route will be helpful. I
have to agree with you on that. I really believe that this is not the time or the place for us to lambaste stupid, idiotic people for doing stupid, idiotic things. It's really not the time or the place. I think that we've got to take this forward and we've got to do something proactive. We know what's been done. We understand that. And I think now's the time to actually say, what can we do about it? And how can we prevent this from going forward? How can we prevent spread? And how can we prevent a similar event from happening again? Can we prevent it? We want everyone to be able to go on holiday. We want everyone to be able to go back to school. We want everyone to be able to go back to some sort of life that we were sort of dealing with before this event. So let's try and be proactive here, and we'll just keep the real feelings closed up inside.
Right, as you've done so successfully. It didn't leak. There was no leakage there at all. That said, I do understand from a medical...
Poker face.
Yeah, exactly. Oh, no. You're clearly a brilliant poker player. I do understand the frustration from anybody, particularly involved in the medical field, because that's who's going to bear the brunt of it. But again, let's now look at how to deal with this. The concern that I have is a lot of these kids have traveled. They have flown, either not realizing that they were positive or they just wanted to get back. What do we do?
So look, I mean, we've had many questions prior to this. Is it safe to travel on planes and that type of thing? And we've held that it is safe to travel on a plane itself due to the HVAC, that's the heating, ventilation, air conditioning system, and the filters on the planes that are very good. But we have said wear a mask and wear a visor. That's the best you can do if you're on a plane, so that if events like this do happen, you are protected. So if there is someone next to you and they do cough or they are super spreaders, you've got more of a chance of fighting this and more of a chance of being able to not pick up the virus from somebody else. What do? We do what the Department of Health, what the NICD, what all the relevant medical bodies are saying. We make sure every single one of those kids that were involved in this super spreading event, whether it's rage or whether it's having gone to the bars after, whether it's not exactly related to rage, it's all related at the end of the day. We make sure that every single one of them quarantines for a minimum of 10 days, but hopefully for 14 days. It's only a minimum of 10 days because that's what the Department of Health has coined as their 10-day term, but ideally 14 days is far better. But we've got to make sure that we're responsible. We've got to make sure that, even if you are going on holiday, you've got a greater responsibility to every single person around you to not spread the virus further. So if your child was there, be responsible. Make sure they don't get back on a plane. Make sure they do isolate and quarantine at home. And that actually means them being at home.
That's what I want to know. What does quarantining at home mean?
That means them being at home in a separate room, using separate utensils, separate cutlery, having their own bathroom, not coming out of that room, not dealing with anybody else in the house, because they are primary contacts. Every single one of these kids is known as a primary contact. So anybody else in the house is then exposed to a primary contact if that child comes out of the room, uses the same bathroom, uses the same drinking utensils or anything like that. So unless they are doing that strictly, then we can't count on anybody actually calming the effects or stopping the effects of this virus spread.
And when during this time is the best time for these kids to get tested?
So look, there's a lot of different versions of when you should get tested. Some say that if you're symptomatic, you get tested straight away, which I agree with. If you've got a fever, cough, shortness of breath, rigors, anything like that, you lose your smell, you lose your sense of taste, go get tested.
Because that's going to alter the treatment, the way you.
It's also going to alter the fact that if we know it's positive, we know where the spread is going. We can track and trace from there. But we're going to have to understand there's going to be many asymptomatic people in this whole group of super spreaders. There's going to be people without symptoms, people without cough, without shortness of breath, without any of the classic symptoms. And so we're saying that the incubation of the virus is about 5 to 6 days. But you can already start transferring the virus or transmitting the virus within 48 hours. So it's an average 5 to 6 days, and it's up to 14 days. And that's why we say 14 days for the entire period. So anything from 48 hours onwards is time for you to incubate the virus. And therefore we say realistically that by day 7, you should have transferred the virus or you should be positive. So a lot of people are going for tests on day 7. But here's the caveat, and here's where you've got to be very careful. Just because you get a negative test on day 7 doesn't mean you're out the woods. You've still got to continue the isolation quarantine protocol for at least 10 and hopefully 14 days. And I really mean hopefully 14 days because I say we want to squash this. We want to break this. We want to actually get rid of this. And maybe it's a good thing this has happened now, okay, before, so that it actually makes people aware that we've got a responsibility and we haven't beaten this virus. Everyone was getting very complacent. Everyone was getting, I'm okay, we can do what we want, but realizing that someone next to you could have the virus without you realizing it, be asymptomatic, themselves not realizing they've got it, and you can transfer the virus. And you want a holiday. Every one of these kids is going home to a family member who's got a grandparent, some of them who have got people with comorbidities. We have to protect them. We have to protect each other. This is not the time or the place. Recently in the last few days in our hospital, we had to put someone who is 33 years old onto a ventilator. I'm not going to go into further details regarding that, but everyone says it can't happen to young people. In my books, 33 is a very young person. So this virus is not...
From my age perspective, that's practically a child, but that's something different.
Yeah.
What's that? What's that, Sam? Just having a look at, just talking about what's going on at your particular hospital. A few weeks ago, when we spoke, I think there were no cases. I think then there were 4. How many cases in the hospital currently?
So a few days ago, early last week, we had 4 cases, and there was 1 case which was under investigation. That case became positive. There were 5 cases. Within the last few days, we've had to reopen our ICU at Linksfield Hospital. We've got people on ventilators. We've got 13 currently in hospital that are extremely ill, that are extremely sick. It's not people just with a cough or a cold. It's people that are really sick. And as I said, the age variation is dramatic from the age of 33 up to the age of 88 at the moment. So this is going up. The numbers are doubling. I know 13 doesn't sound like a lot, but when you've had a week, when you've only had 5, and the week before that when you had none, this is dramatic, and this is going upwards. And there's also a number of patients that have already been admitted from RAGE. I know 14 already admitted into hospitals around KwaZulu-Natal area. So there's lots of drama coming forward.
And what are the hospitals in KwaZulu-Natal, Eastern Cape? What are those hospitals looking like?
Those hospitals are under big pressure. They're full. Their beds are full. I mean, take it out of KwaZulu-Natal. If you go look in the Eastern Cape, if you go look at PE, you've got patients sitting in wheelchairs, getting oxygen in theatre, getting oxygen in casualty because there's not enough beds. And the death rate is very high. So this thing is out of control.
All right. A lot of people are asking us, and we're going to go through the questions in just a moment, but I would say the number one question is coming from people that might be in Johannesburg at the moment who are looking to go down to Umhlanga. That's where they're booked. Either they are staying in a hotel or an apartment there. Should they go or should they not go? Does the place actually make a difference at this point?
Look, you still got a lot of people left over from this Belito rage, a lot of people that were sick there. It does make a difference, okay? For the sole purpose, if you're going to, let's say, your own flat or somebody else's flat where you're staying there over the next few weeks, there's not really a major problem there because you're going to be in your own space, you're going to have your own utensils, your own things. But if you're going into a hotel, it's a bit more difficult because there's communal living, there's communal eating places, there's communal swimming pools, and everyone's together, and it's a lot more risky, and it's a lot harder to try and stop the try and stop the actual spread of this virus. So it's not a simple answer as that you should go or shouldn't go. You've got to take care. You've got to understand that if you go into a hotel, let's say in Umhlanga, you've got a lot of kids there, you've got a lot of adults there, people want to relax, people are going to drop their guard, and you can't afford to for the next few days. I do believe you will be able to go in the next few days, but you've got to take care and you've got to be very responsible.
What about using things like a public pool at one of the hotels or?
I believe it's a responsibility of the hotels to actually put a stop on the number of people in the pool each time. They've got to jack up their COVID protocols dramatically, knowing all the holiday makers are coming. And unfortunately, the hotels aren't going to want to because then they feel like they're not giving the people the holidays they want. But unfortunately, if they don't do that, they're going to have people the holidays that they don't want. So they've got to try and limit the number of people in pools at a time, depending how big the pool is, anything from 10 to 15 children spaced out. They've got to try and limit these things dramatically. They've actually got to try and put markers on the grass or try and separating people from each other because we know that people aren't going to wear their masks. People aren't going to be by the pool. And this is the place of social interaction, especially the restaurants down there. These are all the place of social interaction.
Jodie's asking, she's saying, what about the restaurants? What about kids' activities in the hotels? I mean, should their kids be going to these things?
If you ask me personally, I wouldn't send my own kids to these kids' activities because we don't know what their protocols are. We don't know what they're doing. In your own hometown, you know what people are doing. You know what the protocols are. When you're going to a different area or different environment, things are very different, and people aren't doing things the way that you think they should be doing them. They're doing them for leisure and for relaxation and to try and get the most out from a holiday point of view. But that doesn't necessarily mean it's from a corona point of view.
And does it make a difference? Can you still fly, or if you were going to fly, is it better perhaps to drive?
Sure. This is now depending on people if they can actually be honest or not. So if people can be honest and say, I'm going to keep the 10 to 14 day quarantine and not put other people, my child back on planes and not take them down to other places, then yes, you can. but you're relying on other people. And I still hold, and some people may say it's very sort of fear-mongering, but I still hold you have to go onto an airplane with at least a mask and a visor. You've got to try and limit your waiting time sort of in the airport before and after. I
Because the
myself,
airport, as you've mentioned a number of times, is your more
5
dangerous.
hours before my flight, and I do believe now you go as late as possible, so that they call Howard Feldman on the actual intercom, although that would give me absolute heart failure. But I do believe you've got it. There's ways and means to do it, but you've got to be very careful. You've got to be very careful, and don't drink or don't eat on the air flight. You know, don't go to the bathroom. Just stay in your seat, do what you got to do, and get off that plane if you are going by plane. I myself am not going by plane. I'm driving, but that's me personally.
Natalie wants to know, based on the raised infection, what is Dr. Meyberg's opinion on flying to Cape Town with a 3-month-old baby?
Look, you can't get a 3-month-old baby to wear a mask. You can't get a 3-month-old baby to wear a visor. It's very difficult. You yourself have to wear a mask and a visor. If you can drive down, it's better. If you're going to fly, remember that the younger children are not the super spreaders. And that's also something which you've got to mention now, because there's a lot of people that are saying, they're 18 years old, they're not super spreaders, but actually they are. They aren't children. They are adults. Okay, 18-year-olds are adults. Anyone over the age of 12, 13 is not considered a child in medical terms. Anyone over the age of 18 is what's considered an adult. And that is considered in the age of super spreaders. So a 3-month-old shouldn't be a super spreader, but remember they don't have immunity. So,
so therefore, I think the question would be more about the health of the baby, not the baby's ability to spread.
I would be very nervous to fly with a 3-month-old. It can be done, but I would be nervous.
Okay. And probably not the answer that they were looking for, but a real answer nevertheless. If the infected person is put in their room and no one else in the household has seen them or goes near them and they don't come out of it, do they, must anyone else in the household be quarantined? Well, no, because...
If they're following the rules, then the answer is no. If you're following the rules and you're doing what's being done, but then also you've got to remember now, you've got a bit of a loophole here in a negative way, because a lot of these kids came back on, let's say, Saturday, and they spent time with their family without realizing they had to go in quarantine. Yes. So you've got that 24 to 48-hour period where people didn't know they had to quarantine, and then those people in the house should be quarantining with them.
It's an interesting question from Karen. If a household contact of a positive case has already had COVID about 2 months ago, is it still necessary for that person, the one who had and recovered from COVID, to quarantine? So is it possible, in other words, for someone who has recently recovered to transmit the disease?
You see, and that's the beauty of this virus. We have no idea what we are dealing with. We have no idea what it can do. And we know, we've spoken about it many times, that antibodies sort of wane after about 8 to 12 weeks. We don't know where the T cells are and the memory cells are with regards to fighting this. And obviously no one yet has had their vaccines. But we don't know if these people who have had the virus and who do have antibodies can still transmit the virus. And that's a big worry. And that's why we're saying, yes, they should still quarantine.
Mark wants to know 2 simple questions. Why did the organizers, why were they allowed to hold this event, and why did parents allow them to go? Those are simple questions with very complicated answers, I'm afraid. Other questions, would you say that it is now irresponsible to drive to Umhlanga? Okay, we have spoken about that. Just going through more questions. Mark says if a matric has come back from rage, he's quarantining at home and staying away from everybody at home, using different utensils and staying in his room. His mother is supposed to go away on Wednesday with her mother, who's over 70. Can they all still go away together?
They can go away together, but he can't. The kid that's quarantining definitely can't go. And as long as he's following the rules to the letter of the law. If he's quarantining within the room, not coming out of the room except for using his own bathroom, using his own utensils, not having any interaction with any other family members, then they definitely can go away. But if there's any interaction, then it's a no-brainer.
Leanne wants to know, do you think the second wave is now going to come quicker?
You know, we've always thought that the second wave would come after the holiday. I'm hoping that this event, the super spreading event, will pique or will raise people's understanding that this is not a joke, that this is not something that we can just take for granted that it's going to burn itself out. And people will hopefully realize how serious it is and what the implications of communal gatherings are and what the implications are having large bras together and large events together on a holiday. And we do believe that the second surge or second wave is going to come much sooner. We have always thought it would become sort of end of January, beginning of February. So I don't think this is going to make it come quicker, but I don't think it's going to help in matters either.
Barry wants to know, how long does it take to recover from being so stupid that you go on rage?
So because we're not discussing this on this podcast, great question. I'm not going to actually comment further on that.
All right. So here's another question. Your kid goes on rage. They come back. They are not showing any symptoms. They've gone into quarantine. Would you increase their vitamin intake? What would you do for these kids?
Yeah, that's a great question. I think that you must increase the vitamin intake. They must have their vitamin C. They must have their thiamine. They must have their zinc. They must have their nicotinamide. They must have their vitamin D. Make sure their vitamin regime is up to date. Stay away from all these controversial drugs like ivermectin and hydroxychloroquine, and definitely do not put any person on corticosteroids unless they require oxygen or they need to be in hospital with low saturation, therefore requiring oxygen. Don't be your own doctor. You know, there are great guidelines that were put out by Dr. Sherry Fenneroff on the GP forum and that have been spread across the country, and I think they are brilliant. They say exactly what needs to be done, but the actual main crux of those guidelines is that consult your doctor, discuss it with your doctor. And I mean, she's put it brilliantly. So it's very easy to follow, but you have to speak to your doctor if you're worried, and don't be a hero. Don't make yourself the medical diagnostician in the household.
Let's just talk about the quantums. We're now talking about 18, 19-year-old kids who have come back. What would you recommend in terms of the volumes of these vitamins?
So you want to know the quantity. So in other words, I would say that for vitamin C, I would take 500. This is with people who are actually being considered as contact.
Specifically, I want to clarify that. We are talking 18, 19-year-olds who have just come back from rage. What should they be taking?
Vitamin C, 500 milligrams, 1 tablet 3 times a day. Thiamine, 200 milligrams a day. Zinc, they can have 25 to 50 milligrams, 2 to 3 times a day. Calciferol, if you can get it, if it's available, 50,000 units once a week, or they can take 3,000 to 4,000 international units a day. All of this is just for a week. It's the zinc, vitamin C, vitamin D, which is the calciferol, the thiamine, and the nicotinamide, 50 milligrams a day, also for 5 to 7 days. Make sure they keep well hydrated and just stay quarantined.
And should they be symptomatic at all, that's when obviously talk to
your doctor straight away.
Your doctor, right? Are we seeing complications with teenagers? Or
we do have complications from teenagers. We don't want teenagers to land up in hospital. They are generally stronger than your 50 to 60-year-old bald men. We know that for a fact. Okay, but you know, just because they're 18. Doesn't mean they can't be super spreaders. Doesn't mean they can't get violently sick. We don't want to see that. There are a lot of 18, 90-year-olds who do have comorbidities themselves, you know, whether they're markedly overweight or they're diabetic or they've got immunity problems due to rheumatoid arthritis or ulcerative colitis or any other host of things. So we don't want to hear about, we don't want to see it. They've got to look after themselves.
If there's been just a very brief contact between the family and the kid returning, are they all expected to go into quarantine? They came back, they maybe hugged to say hello, and then they realized, hold on, now we've got a problem.
Yeah, but you see, that's contact. I mean, even if it's less than 15 minutes, that's primary contact. No one, I can guarantee none of them were wearing masks, none of them were wearing gloves, none of them were wearing visors. They're in the same environment. There wouldn't have been a 3-minute contact and they say, okay, now you go in quarantine. There would have been more than that. So it's not really a relevant question unless they decided to come back in quarantine for other reasons.
Right. I think those are the guidelines. That's really what we need to do. What is interesting is the point that you made that maybe this is a wake-up call for people, and I believe it is. Certainly, I can even see my own view of our holiday coming up is very different now following this weekend and the rage outbreak than it would have been on Friday, where I guess human nature is to kind of relax your guard a little bit.
No, so if I can just say one thing, just take control of the situation. Try stay out of the shops as much as possible. Do online shopping. Do click and collect. Don't congregate in crowds. You can go to the beach. You can take your mask off on the beach in your own bubble, under your tent or under your gazebo or that type of thing. But if anyone comes near you, put a mask on. As you correctly said, we don't expect people to waterboard and put their mask on in the water. But, just be conscious. Be socially conscious of what's going on. Keep on sanitizing. Keep up doing everything. Remember that taking responsibility is accepting that you are the cause and the solution of the matter. So we've got to actually take control of the whole situation. And I think before we knock off, I would once again be very remiss if I didn't mention there is good news here. Liverpool won 4-0 last night. I mean, there's no better news than that, so take that forward. We don't want anyone to walk alone, although we might have to for a while. But just take care, look after yourselves, be socially responsible, be unselfish, and just follow the rules.
Yep, and if you're an 18-year-old or a 19-year-old who's just returned from rage, unfortunately for the next 10 to 14 days, you do need to walk alone. I'm Howard Feldman, chatting to Dr. Anton Meyberg for the Synthesis with the Synthesis Sunday podcast. On Monday, our primary focus has been the outbreak of COVID-19 following the super spreading event, which was rage. Make sure to consult your GP, consult Atsola if need be, and stay safe.